A child is diagnosed with a rare form of leukemia. Where he lives, his doctors were able to consult with others who have treated this disease and learn the latest research, even before the studies had been published. But in other parts of the world, where doctors are more isolated, the rarity of this disease would likely be an automatic death sentence. I'm Michael Constantine. Imagine if this was your child or grandchild. You would want his doctors to have access to the most current information available so that he could get the best treatment possible. The goal of WiRED International is to make this essential medical information available worldwide. This is the kind of information that can save countless lives. Using telemedicine and other e-health solutions, WiRED brings vital medical information to communities coping with the challenges of war, of poverty, and of dislocation. Within a single day, WiRED technicians can convert an empty room into a technology hub with global reach, sometimes in places so remote we must use solar panels to power the equipment we provide. WiRED sets up two kinds of information centers. Medical information centers provide up-to-date information to doctors and other healthcare professionals. And community health information centers bring health information directly to everyday people. Medical information centers greatly help areas cut off by war or poverty. For example, in 2003, WiRED techs installed e-libraries in Iraq almost overnight. Information-starved physicians flocked to these centers, eager to enhance their medical knowledge. Since then, WiRED has installed 39 centers in Iraq. Community health information centers reach out to grassroots populations and help educate them about prevention and treatment of specific diseases. Starting in 2002 in Kenya, for example, in cooperation with 12 community-based organizations and the University of Nairobi, WiRED opened 19 centers that brought HIV/AIDS prevention information to roughly 1 million people. Wherever possible, WiRED uses local equipment and partners with local groups to ensure the longevity of its projects. In 2008, WiRED coordinated the formation of the International Telemedicine Network. This is an efficient, effective, and eco-friendly way to bring essential medical information to remote regions of the world. Bringing doctors together via technology saves time and money. Whether following grand rounds, taking continuing medical education, consulting specialists, or researching specific diseases, physicians have access to the latest information, no matter where they live. The ITN can respond effectively to urgent situations and is also able to reply quickly to requests for more information on specific diseases. By sending pixels instead of people, the ITN lowers its carbon footprint. The ITN conducts hundreds of, quote, face-to-face lectures and seminars between doctors separated by thousands of miles. Just think of how much travel time and money is saved, to say nothing of the oil and gas, the vehicles and roads. That's the carbon footprint. WiRED creates connections in the hopes that people the world over will have access to the most up-to-date medical information available. Where you live should not decide if you live. WiRED connects.